Everybody right to go? Yep. There are 39 active cases of coronavirus in Victoria. That's one new case. I want to stress that's not a community case. It's a case of a returned traveller who is safely tucked away in hotel quarantine. So that is essentially another 0 day. We're very pleased to be able to report that to you. There are 23,108 test results that have been received back to health authorities. As you know, there was a hardware problem at one of the private laboratories overnight. That was rectified at 3 a.m, so I want to thank that private business and their staff and their contractors who've worked throughout the night to get that system back up and running. It is now back up and running. I'm advised, just as I approached you then, just a moment ago, that those results are now being fed back out to people, so people are getting the news that they want. Those 10,000 results will be essentially added to this total. So in effect, results received today, so tests done yesterday in the main, 90% of them, will be around 33,000 tests, not the 23,000 that we already have reported. So that's a very strong number, and I thank each and every one of those people for coming forward and getting tested, and of course for those who've had this a minor wait while this technical issue, and again I want to stress it's not a software thing, it's a hardware, an actual machine wasn't working as it should have been. I want to thank those people for their patience, but 33,000 plus tests is very, very strong, and it's exactly what we need. That gives us the most complete picture, helps us protect you, your family and every family, and that's why, despite this wonderful weather and the fact that everyone's got lots of other things to do, if you have any symptoms whatsoever, you must come forward and get tested, and you must be quick about it. There's no good waiting 2 or 3 days, mingling, spending time with others, when you could potentially be doing little more than spreading this virus. We are deeply grateful to so many people coming forward and to all of those who behind the scenes work so hard to get these results to us. Apologies to those who've had to wait a bit longer than normal, but as I just said to you, it's been confirmed for me this morning, only a few moments ago, that those results are now being fed out to people, and that'll happen quite quickly. There are very similar numbers to yesterday, around 2,000 primary close contacts, around 3,000 people who are back in Victoria who hold permits and are here perfectly lawfully, but they're quarantining at home, and that's very important, and we're very grateful to them. I can inform you that there's now 579 exemptions have been granted, so we just, in a very steady, proper, methodical way, we're working through all of those different exemption requests, those important applications that have come through the system. There are extra staff there, and we're working through that as fast as we possibly can. Beyond that, we are about to have a National Cabinet meeting, and I'm very pleased to say that it's my expectation, I'm very confident that we will see issues like pre-flight testing, issues like flight crew being tested when they get here, being treated in effect as if they were a returned traveller, a whole range of measures that we've pushed and advocated for, particularly in light of the UK strain. I believe they'll be adopted by National Cabinet, and I think we've already seen overnight, you'll remember yesterday much of the press conference was about the need to test all the staff in association with hotel quarantine as often as possible. I think ideally every single day, as we do, and you've seen some other states make announcements to that effect already. That'll be something that we discuss at National Cabinet today. I think given the extremely infectious and contagious nature of this UK variant, it is very, very important that we do everything we can, never making it 100% risk-free, but just each layer, each additional step that we take is all about keeping us safe. I just want to, before we go to questions, I just want to make the point that any reporting about the UK variant not being new to Victoria is simply wrong. The strain we are talking about at the moment, that is so much more infectious, is not here. It has not been here, and it is our aim to keep it out. We've had virus come from the United Kingdom way back in June. That is not the same as the variant that is presenting as much more infectious, that's a matter of fact, and indeed there's a growing body of anecdotal evidence that people are getting more sick more quickly as a result of contracting that UK strain. So that's just to be clear. We've had UK virus, we've had virus from all over the world, but it's not the same as the variant, the one that's got all of us very, very worried and concerned, That's not something that's been a feature of our virus as it's presented. That's new, and we need to do everything we can to keep it out. Can I just send my best wishes to everybody in Brisbane. Premier Palaszczuk's had to make some very difficult calls this morning. I fully support those calls. It's very challenging, but obviously problems in one part of Australia become problems for the whole country if we don't manage these things consistently and well, and I think that's exactly what Premier Palaszczuk has done. More than happy to take any of your questions, noting that I do have to get to that meeting fairly soon.
What's your message to people in Brisbane that are here in
anyone in Queensland now?
Sure.
Maybe trying to make their way back, do you think?
We will have some updated advice. These announcements have only been made literally 30 minutes ago by the Queensland Government. We'll have some updated advice based on public health advice as soon as possible. We'll be briefed on the circumstances in Brisbane by the Queensland Government, by Anastasia, when National Cabinet begins in just about 20 minutes' time. And our public health team are already working, speaking to their counterparts in Brisbane. The government is speaking to its counterpart in Brisbane as well, and we'll have some updated advice as soon as we possibly can about what impact this may have on people who are in Brisbane, whether they be people who had only ever been in Brisbane or people who had been in Sydney and got out of Sydney to Brisbane, and there are a number of Victorians who've done that. I can't give you a definitive answer now, but hopefully in the next couple of hours we'll have a very clear view and we'll be able to communicate that to people.
In the meantime, would you like to stop
Sorry.
flights coming from Queensland in the meantime?
Well, part of it is to properly ascertain how many people they've got locked down. For instance, as just one feature. So, Laurel, there's one case. It's a cleaner that's come out of hotel quarantine. I think there's been a 3 or 4 day period when they suspect that person may well have been infectious and been out and about doing normal things. Part of the briefing this morning and part of the work that's going on as we speak, Chief Health Officer to Chief Health Officer, will be a better understanding of just how serious they think this outbreak can be. Obviously, they rank the risk fairly highly, given that they've taken this step to essentially go to 4 reasons to leave home for Greater Brisbane. So, rather than me expressing a preference, let's wait and get the public health advice. That'll be based on what's actually happening, the epidemiological picture on the ground in the Greater Brisbane area. And as soon as we can possibly give advice, which will be clear and based on advice, it'll be there as soon as possible, and hopefully that's only in a couple of hours.
In their news conference this morning, the Queensland authorities said that anyone that's been in Brisbane since January 3 should isolate for 3 days. It would be fair to say that applies to anyone that's now in Victoria that's been in Brisbane.
I need to get some further advice on that. And what's more, obviously if you're from Victoria and you're in Brisbane, the rules that apply in Brisbane apply to you. So this issue about bolting home, that may not be one of the 4 reasons that you're allowed to leave wherever you are staying. So there's just a few things, not just technical issues, but there's the science of it, what's happening on the ground, what are the public health experts when they talk to each other, ours and theirs, what do they come up with as a prudent and safe way forward, and I wish I could make those decisions within 25 minutes of Anastasia Palaszczuk announcing things, but that would not be the best way to go. We'll get that advice, and as soon as we can confirm that, not just for Victorians who might be wanting to go to Queensland, that won't be possible. I wouldn't have thought, and also those who are Victorians who are in Brisbane and want to come home during this 3-day period, we'll get that definitive advice. But I can't do that in 20 minutes. It's got to be done properly, and it will be done as soon as it possibly can be.
The virus that the cleaner has. I know it's Greater Brisbane that's been in lockdown, but do you anticipate, measures that will be imposed on Victorians or in other parts of Queensland?
Oh, look, I think that it's too early for us to say. Obviously, I think it's reasonable for us to assume that the Queensland Government have done a 3-day lockdown or stay-at-home order, the 4 reasons to leave order, as I'm briefed, for the Greater Brisbane area. They haven't extended that beyond Greater Brisbane, so obviously they've got a degree of confidence that this is a relevant issue, that the risk profile is relevant to that part of Queensland, not the whole of Queensland. But again, I know I wish I could provide you with that definitive answer right now, but if everyone can just be patient, we'll work through this in a methodical way, and hopefully in the next few hours we'll have absolute clarity for everybody from Victoria in Queensland. Anyone who wanted to travel to Queensland and had those plans made for the weekend, for instance, we'll provide people with definitive and clear advice as soon as possible. But by its very nature, because it's based on facts and because it's based on science, our public health team have to have a clear understanding of what's going on in Brisbane. So do I, and that's exactly what we'll be briefed on by Anastasia personally at the National Cabinet meeting, which starts very, very soon.
And would that advice be given, I guess, later this afternoon?
Hopefully before then, but as soon as possible.
Will you be back out?
No, I don't think I will be, but I think that the Prime Minister will speak to a whole range of issues coming out of National Cabinet, as he normally does. And I thought it was important to give you the numbers of the day and to make it clear to you that I'm very confident that the positive plan to keep this UK strain out of Victoria and therefore Australia that our state, that our government has advocated, will be agreed to by National Cabinet today. I think that's a really important step. As the Brisbane development obviously is new, there'll be a Chief Health Officer release later in the day, and we'll be as clear as we possibly can be for all those different groups of people, and hopefully that's only a matter of hours off.
Just on the investigation in Melbourne, the Vermont South case, has there been any further update on links there? Has it been linked to Black Rock? How's that
No, not. Well, obviously there is via the genomic sequencing, there is a link to Black Rock insofar as they've both come from Sydney. They both match up with the Sydney strain. But whether there's a connection and whether the transmission events are linked, we're still doing all that coronavirus detective work. And if there is any update that the Chief Health Officer can provide, then that'll be part of Alan's media release later on today. And if there's a need for him to stand up, then of course he will.
Are you feeling confident that certainly the Black Rock cluster is under control now? We've had a few days of no cases of that cluster.
Yeah, Laura, I'm certainly confident that the contact tracing team, with the great cooperation and assistance of many thousands of Victorians, we have that Black Rock cluster not quite run to ground, because we've still got people who haven't yet tested positive. There's still a number of people that are at home, and we do urge all of those people to do as they're asked. We do check on people. There's a proper framework, but I wouldn't say it was over. But we're very confident, I think, and very positive about the fact that we're not seeing further chains of transmission. We're not seeing further outbreaks that are in some way linked to that Black Rock outbreak. It may well be Vermont South is. Finding that link is sometimes the hardest thing, and I just take you back, as I did yesterday, in the very early hours of the positive test out of Black Rock, we had a number, which was not apparent at the time that it was from Black Rock, we had a number of different positives and thought there could be as many as 3 different outbreaks. Our coronavirus detectives did that work, and they did it really fast, and we were able to link it all back to that one cafe, and then family visits and different chains of transmission within that one evening where people were at that, or one afternoon evening that people were at that particular eatery. We will continue to do that work, and the hope is that we can draw a similar link to what has occurred in Vermont South. But that's ongoing, and as soon as there's anything we can provide to you by way of update, we will. But long way of saying yes, there is a degree of confidence that we are very close to running Black Rock to ground and having a real stability around those numbers, and you see that reflected in lots of tests, really big test numbers, and thank you to everyone who's getting tested, and very low or no positive case numbers as a result of that. That's exactly what we want and need.
Does that confidence run to the...
Contact tracing has improved. It seems that there is still room for improvement. Lots of people have been told to isolate. We've just told the ABC have been getting conflicting messages about whether they should isolate for 14 days, you can isolate till they get a friend, see what people have been to exposure sites. Why are those conflicting messages still coming through? And when these people get calls, it's like the people are just reading off the script. I understand you're using call centres. Do these people need to be, I guess, better?
No, I wouldn't. Well, look, I'm happy to follow that up with the public health team, but I wouldn't want anyone to think that the staff are not absolutely committed and dedicated to this important work, and they're very well versed in what needs to happen. Obviously, whenever you've got one group of people communicating with another, there's always the risk that people at either ends of that conversation or email chain or whatever, text message or whatever it might be, or face-to-face meeting, don't necessarily walk away with the same view of things. It has absolutely improved. The numbers don't lie. You know, you don't get 0 days with this much testing if your contact tracing is not absolutely first rate. And I thank all those people. But equally, every day is an opportunity, and we are obliged to keep on improving. There's always things you can learn. As to the specifics and what you've been told, I'm more than happy to follow that up. But I can tell you there's a big team, and they're all working as hard as they possibly can to get the best information out as quickly as possible and to communicate with people as accurately, as fairly, as concisely, as often as is needed. And it's not just about what they have to do, it's also what do you need? Are there things we can do for you? Is there support that you need? Now, just on that issue, if I can say that we're having a look at whether there are a number of casual workers, a number of people who, if they had a positive diagnosis, would be eligible for that $1,500 payment because they do not have a positive diagnosis, but they're doing the right thing to protect all of us by isolating at home. The casuals, those who would normally qualify, we're having a look at whether we might be able to extend that payment, but we'll have more to say about that at the appropriate time.
Well, just on another matter, the Melbourne... Yep.
Vermont South?
I was just going to say, 2 days have doubled to zero.
Yep.
There were fears earlier this week that Vermont South cluster might explode if we had acquisition of MCG or Shadston.
Yep.
I'm fairly confident now that that's not the case.
Oh, look, I think it's fair to say that there is greater confidence about Black Rock because time has passed, tests have been done, contacts have been traced, and we've been able to lock people down, and we're grateful, very grateful to them. Businesses have worked very closely with us, all of those things. This is, in some respects, you've got to act fast, but there's a bit of a waiting game involved in this as well, and the passage of time is an important factor. I think it's too early for us to say that we are as confident about the Vermont South case. That's just the factor, that's just the nature of this case as a mystery case. That means there's at least one other person out there who's got it and gave it to the Vermont South guy. How he has acquired it, who else has acquired it as part of that chain of transmission, that's not yet known to us, and that's why people who are at those shops at Chadston in those time periods need to get tested, particularly if they feel unwell or if they remember being unwell at that time. People from that Zone 5 at the G, they've all been contacted about testing, and I haven't got an update for you in terms of some of the breakdowns of how many people have been called to test and how many have had the test done, but if we can get you some of that information, if not today then tomorrow, then we're more than happy to do that.
2 days ago, Professor Cheng said that the Vermont South guy's housemate was developing symptoms. He
Yes.
had developed symptoms and he had been tested. Has he received his
I'm not
result?
sure of his result. I think it unlikely that he would not have received his result by this time, and we have no local community transmission. So there's a process of deduction there, but let's not impede on the privacy of that person. But I'm more than happy to follow it up for you. We committed to do that yesterday, and we didn't have anything to say to you. So obviously it wasn't positive yesterday. I'm not sure whether that's evolved overnight. It won't be caught up in those numbers that did not get passed on because of, those results that did not get passed on because of the hardware problem. They were predominantly, almost exclusively regional tests, so that won't explain it, but if there's anything we can add to that, we will.
The Queensland case, does that strengthen your case in terms of your argument with National Cabinet about including those hotel quarantine screening procedures?
Well, I'll be going into National Cabinet this morning and I'll be recommending to people that they test everybody every single day. That's what we do, and that doesn't mean it can't get out. And it's because of that point that you'll never eliminate this risk, you can only manage it. We all have to assume everybody in hotel quarantine's got it, and everybody in hotel quarantine as a staff member can catch it from one of those people in a hotel. If you're testing everybody every day, then the maximum jump this virus can have on all of us is 1 day. At the moment, we've got a situation in Brisbane where it would seem that there are a number of days, but the good news there is this is very new, this UK strain, and I think the Queensland Government have indicated they're going to move to everybody being tested each day. So that would be, from bitter experience, Victorians would urge and recommend to every single government across the nation. Our plan, the way we're doing it, is the best way to go. Test everyone every day, and then test their family weekly, and advance contact trace their family so that you don't have someone who's working in aged care sharing a house with someone who's working at a hotel site that is obviously by its very nature a very risky place to work. We're very grateful to our staff, and we're also very grateful that we've done, must be close to 35,000 tests now. So everybody gets tested every day. That's not necessarily the most pleasant experience to go through, but we're very grateful to every single staff member who's doing it because it's an important part of keeping all of us safe. It's not about looking backwards or being critical in any sense. We're doing it, we think it works, and we're simply saying to people, you should do this too. Because if you've got a problem, everyone's got a problem. This thing travels, it doesn't respect state borders. We know that only too well. All of us need to be doing something that I think is nationally consistent, because that's the belts and braces approach. That is the highest standard, not to eliminate risk, but to manage it. That's all you can do. And if you've got multiple actions at each point of potential weakness, and you've got redundancies for those as well, like the family test, for instance, That way, you can have a greater confidence, not a certainty, but a greater confidence that you're doing everything physically possible to keep something like the UK strain or the South African strain out. That's exactly what we all have to be doing.
Can I ask on another matter? On the 26th of January, we understand there's no Australia Day parade, but City of Melbourne.
Yes, I have heard this. Yeah.
Reportedly supporting in a logistics sense the Invasion Day protest. Should we be supporting any public events, whether no matter what side of politics you're on?
Yeah, I'm at no point have I been engaged in trying to determine which events are more worthy than others, right? It's not about what you're gathering for, it's about are you gathering in a safe way. Now, the City of Melbourne can speak to what it is they have planned, but I just want to be very clear with the City of Melbourne and with all Victorians. Any event of that nature, or any nature really, has to have a COVID-safe plan. No such plan has been submitted. And that event, like all events, would have to satisfy the Chief Health Officer that it could be done safely. Just on the issue and the obvious point of comparison, there's no parade this year for Australia Day because it's not a seated event. Now, I'd like nothing more. I attend it every year. The flag raising, it's a very important part of the way we celebrate who we are every year. But that is, by its very nature, it's not a seated event, and the judgment by the public health team, not by the politicians, by the public health team, was that it could not be done safely. Therefore, it's not happening. There are other things we're doing to mark our National Day. In terms of that particular proposed event, that is a matter for the City of Melbourne. They can speak to that. But what I can say to them and to all Victorians is it'll have to have a COVID-safe plan. We've received no such COVID-safe plan. And the Chief Health Officer is not easily impressed when it comes to these things. He will look at this very carefully and closely. No one, regardless of why you're gathering, should be doing anything to put what all of us have built together, this precious thing, in any risk, in any jeopardy.
What can you tell us about the precursor to the mutant UK strain that escaped hotel quarantine in Victoria mid last year?
Sorry, Samara, I'm not quite following.
The precursor to the mutant strain that escaped hotel quarantine in Victoria mid last year.
I can't tell you anything about that. I'm not a genomics expert. The point I think if you're referring to the...
You briefed about it, sorry, if it had escaped.
Yeah. I stood up at a press conference and talked about that the genomic sequencing meant that at least a significant majority of cases had come from hotel quarantine. That isn't new. If you're wanting me to give you a sense of not just that it was sort of contained or not, but a description of that particular strain of virus, I can't do that, but I'm more than happy to get Alan Ching to speak to you about that. The point I'm making more broadly is we've had virus from all over the world in Victoria and in every state in our country. The virus didn't start here, but it is wrong to say that the UK strain that we're all absolutely concerned about right now was here months ago. Arguably, it didn't actually exist months ago. It's a new strain, and the nature of a new strain is that it is new. To report otherwise is simply wrong.
Doherty Institute says that it was a precursor to that
strain. But hang on. Within the amateur epi picture I can give you, everything's a precursor to the current strain. It's the same virus. So everything's a precursor. But UK virus 4, 5, 6 months ago wasn't 50% more infectious. Wasn't, at least anecdotally, making people much more sick much more quickly. So, I think the average person watching this knows that every strain of coronavirus, there was a precursor. Of course, it's the same virus, but it is changing, and the most recent UK strain that is just wreaking havoc in the United Kingdom, and we send our best wishes to our friends there. We don't want that here. It's new. We have an opportunity to keep it out, and we all have to play our part to do that as best we can. None of us can guarantee that we can keep it out, but we all have to work as hard as we can to try and achieve that.
Hamir, just on hotel quarantine, last night a Sydney couple were released after being detained for 6 days. They maintained that when they arrived in January 1, they should have been allowed to return home to Sydney instead of being detained. Is that your understanding?
I've got no advice on...
I've sent the details to your office yesterday.
Yeah, well, many people send many details to my office. With the greatest of respect, I don't necessarily wait around for a briefing on every question that you've sent in. I haven't seen your request. If we can follow up, then we will. But I'm not briefed on every case. I don't think anyone would expect me to be. But if we can follow up, we will, as we have done on literally thousands of occasions over the last year.
Just on another hotel quarantine case, there's a woman called Moko who was detained when she went to pick up her children from the airport.
Yes.
She's applied for an exemption. She was told yesterday that by the health authorities that they were under the impression she had been in Sydney when she hadn't. She says that they've lost the processing receipt for her exemption. Is that acceptable for you?
Well, let's establish what's gone on there. There's a bit of he said, she said in that. I'm happy to get the facts and then we can make a judgment based on that. Everyone's trying to do the right thing. Everyone's trying to be as fair and as reasonable as they can be. But, I think the important thing here is to be guided by the facts. That's an important rule of public health. Let's get the facts of what's occurred there, and then I'm happy to have the relevant officials speak to you and provide you with, within the bounds of privacy, whatever additional information we can. But the key point here is, borders aren't shut for fun. They're shut because we just can't have a situation where people, of course, Victorians, we want them to come home, but we can't run the risk that they're bringing the virus with them. And I know that's deeply, deeply frustrating for those who are caught on the other side of the border. We get that, we understand that, and that's why we're working night and day to bring under control cases in Victoria. And we've just talked about Black Rock and the fact that that is fundamentally under control. We've got this other case, and if it weren't for that case, then maybe we'd be further along in terms of getting the borders open. But it's also, can I say, even more so than what's happening here, it's what's happening in Sydney and greater New South Wales more broadly. Perhaps the better way to put it would be is if it weren't for instance, that particular trip, that was that camping trip that was made to a whole range of regional parts of New South Wales, maybe we'd be further along. But all of that maybe stuff doesn't help anyone. We're doing the work. We'll have more to say as soon as we can, and the moment that the health experts tell me it's safe to get those people back, that's exactly what we'll do, and we won't waste a moment doing it.
Just to clarify, you said yesterday you were hoping to have an announcement next week. Would you anticipate that would be an announcement about the border opening in a few weeks' time after that, or would you, if things go well and continue to go well in both states, that we could even see the border reopen as early as late?
Oh, look, it's hard for me to predict what I'll be announcing next week, but I'll put it to you this way. I would hope, and what I'm working towards, and what I absolutely want to be able to do sometime next week, is to say that people can come home, and they can come home soon, not in a few weeks later, but as soon as possible. But that really does depend on what's happening with the virus, with transmission, with case numbers in not just Sydney, but in New South Wales more broadly. And that'll be testing, how much testing is being done, what does the wastewater surveillance tell us, how many cases are there, how many exposure days were there, all of those things. That it's not me that sits down and goes through the spreadsheet, it'll be the public health team, and then they'll provide me with advice. And believe me, none of us took the decision easily or lightly to close the border, and we'll get the thing open as soon as we possibly can. And despite the inconvenience, and we apologise for that, I think the vast majority of Victorians, when given a choice between, yes, difficulty for some people, and we'll support them if we can, or difficulty for every Victorian, that's not actually a very difficult choice to make. Our job is not to be popular, it's to protect Victorians, and that's what we're 100% committed to. And any other issues? No, thank you. We shall. Oh, well, no, I have to go to the meeting. We'll follow. We will follow up on all the things that we have committed to follow up. Thank you.
I hope there's a mad run up.